class. Today we'll be talking about cerebral palsy. So what is it? It's a disorder of movements and posture caused by a non-progressive abnormality of the immature brain that originates either during the prenatal, perinatal, or first few years of life that results in significant impairment of functional mobility. To break it down a little bit, cerebral equals brain, palsy equals weakness or problems using the muscles. The four major subtypes are spastic, dyskinetic/athetoid, which means slow, writhing, involuntary muscle movement, ataxic, which is low muscle tone or poor coordination, and mixed cerebral palsy. But the spastic form is the most common. So some signs and symptoms. Some general signs and symptoms you'll see are delayed motor development along with hearing and vision problems, limb spasticity/involuntary movements, and seizures are really common in about 50% of these patients. Also difficulty swallowing. Now this could be an oral sign and symptom too, but I just put it under general just because it had to do with the muscle weakness. So some oral signs and symptoms are enamel hypoplasia, dental erosion, which is caused from their acid reflux. A lot of these patients will have really bad acid reflux, causing the stomach acids to come back up or for them to vomit a lot. Delayed eruption of permanent teeth, lack of lip seal, which can lead to mouth breathing, high malocclusion rate, temporomandibular disorder, increased risk of dental caries and periodontal disease, which is kind of obvious in a way if you look at all their other oral signs and symptoms that this could put them at an increased risk. Oral hypersensitivity, a hyper or hypoactive gag reflex, and a prolonged and exaggerated biting reflex. So just be really cautious when you put your hands in their mouth. So some potential problems related to dental care. Patients may have poor oral hygiene, and this could come from them not being able to provide it themselves, or their caretaker isn't able to provide it for them, or just don't put in the effort. Certain medications they take can cause xerostomia. Some patients may have oral hypersensitivity. Due to their malocclusion and lack of lip seal, mouth breathing could be an issue. And muscle relaxants and anticholinergics cause CNS depression, so use caution with clonidine. Conscious sedation is not recommended. I believe this is not really recommended because patients with cerebral palsy oftentimes may have a smaller trachea, or it's really difficult to keep their airway open, so this is why I feel like that sedation is not recommended. So some common medications that you'll see patients with cerebral palsy taking is diazepam. And most of these are for controlling their spasticity and rigidity. So diazepam, side effect of that is excessive drooling, anticonvulsants, which side effects can be gingival hyperplasia, xerostomia, dysgeusia, and stomatitis. Anticholinergics can cause xerostomia and bruxism, and muscle relaxants can cause xerostomia. And I have a little starred part at the bottom that just says local anesthetics can be used unless otherwise specified by a certain medication. Need for pre-med? From what I see, I don't believe they need a specific or prescribed pre-med, just their normal medications to help with their symptoms. Dental hygiene and modification. So make sure to use short and clear instructions given one at a time. This is important because oftentimes they will have that delayed motor development, so just make sure they completely understand. Use the show, tell, do method, and this can either be done with the patient or the caretaker, depending on who's going to be performing the oral hygiene. Insert instruments slowly and place head in a downward position in case of hypergag reflex. Do not force their limbs into natural positions or stop uncontrolled body movements. This is really important because this can cause nerve damage to them, and as we know too, if they're having uncontrolled body movements during a seizure, you do not want to try to stop them or control them because that could hurt them and it could hurt you. Minimize lights, sounds, and sudden movements that could trigger seizures. These patients may need to stay in their wheelchair. That might be easier. So just lock the wheels and try to tip it back, or just do it with them sitting up if that is what is best for them. It's important to be able to communicate verbally and or non-verbally, so with gestures or signals, because they might not be able to talk to you, but they can see what you're doing and figure it out with gestures. And again, oral hygiene for the caretaker. Something that might help them is to when brushing their patient, brush them in a supine position with a mouth prop if necessary to keep their mouth open. So to prevent problems or emergencies, just be aware of their medical history. What medications are they taking? The seizure information, like how often do you have seizures? Do you ever have one that doesn't stop? What triggers them? Also use HV often in case of drooling. Because some of their medications can cause excess drooling, it's important that you're using that HV constantly to get that out. It may help to have their caretaker present, someone that they're familiar with, or the person that's going to be performing these once they get back home. Again, to prevent, just minimize lights, sounds, and sudden movements that could trigger seizures, and warn a patient before any stimulus may occur. Lastly, keep appointments short and efficient. You don't want them to be there too long, but you want to make sure they get what they need done in a quick and timely manner. These are my sources. Thank you for listening.